My name is Gregor McNeill. I'm a consultant in acute and intensive care medicine here at NUH. One of the most important tasks you have as a doctor is to recognise when one of your patients starts to get sicker. We know from our own and national data that there can be a delay in patients getting the escalation in care they need. We know that the longer the delay to effective treatment can lead to worsening organ failure and death. Tragically, even today, patients still die because a junior doctor failed to escalate to a senior. Every NHS hospital now uses an early warning score or EWS system to ensure sick patients are recognised and escalated in a timely manner. Here at NUH, we use our own specific NUH system. This system is now delivered electronically using eObs. You will be provided with an eObs device and instructions on how to use it. Of note, there is a separate scoring system for paediatrics called PEWS and obstetrics called MUs. In common with other scoring systems, a score is assigned to a number of observation parameters. As the patient gets sicker, the score rises. Once the electronically recorded score rises above a specific level, a message is automatically sent to the relevant team members, including the nurse in charge, critical care outreach, and you as the medical team member. There is a mandated medical escalation response for each level of EWS score. You must be aware of your role within this pathway. There are 3 levels of response for adult patients. First, the patient is becoming sick. The EWS has been 3 for the past 2 hours. You will be contacted or messaged by the nursing team to review the patient. You must review the patient within 60 minutes and document and time your review in the medical notes. The patient is deteriorating further. The EWS is now between 4 and 5. At this level, you will be automatically messaged to review the patient. Once the patient has become this unwell, you must review the patient within 30 minutes of receiving the message request. You must document and time your management plan in the notes. Crucially, you must then immediately discuss your plan with either your supervising SPR or consultant, whether the supervising SPR is resident or on call from home, whether it is the middle of the day or the middle of the night. The patient is now becoming critically ill. The EWS is now 6 or above. Once the patient has an EWS of 6 or above, they are by definition critically ill. Any delay in treatment could result in cardiac arrest. You must review the patient within 30 minutes of this score. You must request an urgent registrar review. Arterial blood gas sampling and high concentration oxygen should be considered at this time. The management plan must be documented in the medical notes. Crucially, the SPR must discuss the management plan with the supervising consultant at the time of deterioration. Again, whether it is the middle of the day or the middle of the night. This discussion must be documented in the medical notes. At this time, your consultant will consider whether a referral to critical care is required. If limitations in care are being considered, they may also consider changing the eObs observation model. Remember, the eObs observation model can only be changed on a consultant eObs device. These are the key features of the adult escalation pathway. Remember, using eObs will allow you to monitor the progress of your patients remotely. You will receive separate training on eObs when you receive your device. Please also note, training on the separate pediatric early warning score will be covered in your local pediatric induction. The escalation pathway may appear daunting, but remember support is available. In parallel with your response, staff will notify the Critical Care Outreach Team, or CCOT, of any patient causing concern or with an EWS of 4 or above. CCOT currently operate between 8 a.m. and 10 p.m. every day. CCOT will be moving to a 24/7 cover model during 2015. Outside the current CCOT hours, the Critical Care Outreach Team are always available. CCOT have huge critical care experience and will support you and the ward staff when managing the deteriorating patient. Also remember, any referral you make using the EWS escalation pathway can be made more effective and safer if you use a standardized method of communication, such as SBAR. Remember, situation, state your name and the problem you are calling about. Background, mention the admitting diagnosis, background to the current problem, and background comorbidity. Mention the relevant treatment so far. Assessment. State your assessment, including A, B, C, D, E, and EWS score. Remember, your colleague will be able to review the relevant handover information and eObs on their device. Recommendation. I think the problem is this. State what you would like to be seen done. Determine timescales. Is there anything else I need to do? SBAR prompts are available on all wards. Additional information regarding SBAR, as well as the EWS escalation protocol, is available on the NUH guideline app. This can be downloaded to your own NUH eObs device. If you wish any further information or wish to receive a replacement EWS lanyard card, please feel free to contact the NUH, EWS and PEWS education team. Remember, you must follow the EWS escalation pathway without exception every time you see a deteriorating patient. So remember, an EWS of 3 for 2 hours or more, review within 60 minutes. An EWS of 4 or more, review within 30 minutes. An EWS of 4 or 5 you must discuss with the SPR or above, and an EWS of 6 or more you must get an urgent SPR review and the patient must be discussed with the supervising consultant. Thank you.